Hello, everybody. I think participants are still entering. Let's see. It's great to see the names popping up. We'll just wait a minute for everybody to join, and then we'll get started. Okay. Yeah, what do you think? Okay, that looks like we've got lots of people who have joined. So welcome everybody to this webinar this afternoon. It's great to have you back, welcoming you back from my bedroom. If you're here in the EURORDIS membership meeting, I feel like we're sat here again. But we're here today to discuss the 30 Million Reasons campaign and the action plan for rare diseases, Europe's action plan for rare diseases. So we will have two opportunities for you to ask questions where you can speak. So if you write in the chat as you go, if you have a question, if you have any questions as we speak, please do write in the chat. We're here to answer them. This is what today is all about. So the first half of the webinar will be a chance for us to familiarize ourselves with the action plan. As I said, it's been a couple of months since we last met, and the thinking has perhaps developed since then. So we'll review the action plan. In fact, there won't be breakout groups, sorry, that needs to be updated, but there will be a Q&A. And then the second half of the webinar will be a chance for us to see where we are now, what has happened with your help over the last couple of months, what's coming up next, and how you can continue to help us and support this campaign. So alongside me, I have Kostas, who's Public Affairs Manager, and Anna Cole, who is Public Health Policy Director. And I'm going to pass over to Anna now to talk us through the action plan.
Hello, everyone. I wish I could see you all, but I see names, so do feel free to write in the chat just so we can get a better idea of who's there. I see Hannah. Hello, Hannah, one of our interns. Hilde. I'm just going through a few names. Anyway, it's nice to see you here again. I think having looked at the registrants list, we kind of have a variety of people who have probably heard this maybe a number of times, those who are hearing it for the first time, and some of us in between. So as we're all landing in a kind of back to school mode, we'll repeat a bit of the background, but mostly, as Jenny said, give you an update of what's new and what you can do next. So since our last member-wide meeting around this action plan, we have launched officially the campaign. If we can go to the next slide. And launched the campaign for what's a very targeted political or policy instrument. So I thought we would start out with what is an action plan. You'll remember that this campaign, this whole effort, is coming off the back of a reflection called the Rare 2030 Foresight Study, in which we reflected over 2 years with a number, hundreds of experts, on where we would like the future of rare disease policy to go. And what we recognized in terms of the current policy-making landscape is that the action plan would probably be a good instrument to introduce those recommendations and to put them really into action. So an action plan is a commission instrument that is used across other areas of health, but actually other areas of EU collaborative policy altogether. And it's part of what's called the Better Regulation Agenda, really, as a way to not only make sure that policies are guaranteed that they're based on evidence, and to somehow simplify the process. And concretely speaking, it's a plan, as maybe some of you are familiar with these plans for the Pillar of Social Rights or for cancer. They include a number of steps, starting with a roadmap of what will be included or when it will be launched, and a number of consultations on what should be included, and then of course a final adoption. So next slide. We know that in general, obviously the sort of fruit of our discussions over Rare 2030 was that we needed an updated outlook on rare disease policy. And so this action plan coming at this point in time, just to remind you, is of course an opportunity to give some renewed focus to rare diseases as a public health priority. It's been some time, and I'll go over that in upcoming slides, since we had this kind of overarching legislation for rare diseases. We hope that this overarching plan will not only create a roadmap for what Europe is doing for rare diseases, but can be mirrored in national plans, and of course always with adequate funding, which hasn't been the case until now. It can help make sure that that's integrated and really ensure that Europe's actions have an added value. And the maybe newest piece, because all of this is true for all of EU level legislations today, is that the newest piece for rare diseases is we'd really like to introduce a set of measurable goals in this plan, because we know that the field of rare diseases is really kind of at a pivotal moment where we are having a better idea and understanding of where we are living as people living with rare diseases, what diseases we have, how many of us there are, the delays in diagnosis, the number of treatments, research projects. More and more we're able to create that baseline. And so it would make sense that in order to move things forward, we create a set of goals for ourselves to reach by 2030. So next slide. That landscape and baseline is maturing. It's obviously still needs quite a bit of work, but there are a number of things that we do know, quantitatively speaking. We know that a huge majority of rare diseases start in childhood. We know that there are a number of premature deaths as a result of those rare diseases. We know that there is an average 5 years of delays of diagnosis from the moment that you have symptoms. And we know certainly that there's lacking data and a adequate threshold of data in order to be able to make any progress in terms of natural history or anything else. And so by considering some of these baseline numbers that we already have, we can start to generate these goals as aspirations that we might be able to reach in the next decade. The other thing that we all can agree on, I think, as I mentioned just earlier, is that the current policies are not only not addressing these unmet needs that we just saw in the last slide, but they're also outdated, so they're not addressing them in the right way. You'll remember, of course, going back, starting with the 2000 OMP regulation, that was obviously a landmark legislation that set out a number of priorities and activities that followed suit. And moving up to 2008 and 2009, two really key pieces of legislation that helped define Europe's plan for rare diseases at that time, and a council recommendation where member states self-mandated to have plans that mirrored the contents of that communication. So that's been a long time. And since then we have all sorts of trends, new opportunities, new values, new expectations, not only from the rare disease community, but from all of the actors that we depend on as well. And so it would make sense that we revise some of these strategies. Now, of course, we recognize the fact that a lot of legislations that are relevant for rare diseases are currently being updated. Legislations around, again, orphan medicinal products, and in a larger way around how the pharmaceutical industry is legislated at the EU level. But also around the pillar of social rights, around disability, around cross-border healthcare, really a number of legislations that are also being considered. But what we would really like to emphasize that ideally this would happen in a coordinated way, and it doesn't necessarily replace the fact that we still need a global vision for how all of these moving parts work together. So next slide. Which brings me back to the Rare 2030 recommendations. That's really kind of a basis for the reflections that we started there. Again, for those of you who are not familiar with this project, it was a commission and Parliament sponsored project in which we had 250 experts go through a set of stages of reflection where we consider what our ideal future would look like and then the steps to get there. And so the ultimate outputs of that project were 8 detailed recommendations on a number of subjects that you can see here, designated by the infographics. So from diagnosis to research to drug development to access, data, patient organizations and partnerships of all kinds, etc. And what's central to all of those recommendations is the fact that they really need to be convened in one coherent and long-term plan, both at the European and the national levels. Next slide. So that's a bit of the background, if you will, of what we reflected on in Rare 2030 and how we got to the idea of the action plan being the best way to, as I said, put these recommendations into action. And in starting to shape that action plan, and trying to implement this really paradigm shift from just thinking about the infrastructures that we need to make changes in the rare disease space to more measurable goals that we would like to achieve that are directly reflecting better outcomes for people living with rare diseases, we decided to focus on 3 goals. And you'll notice that for those of you who are familiar with the Sustainable Development Goals, and I'll go a bit into detail about what those are for those of you who aren't, they very much mirror those. And so that's not by coincidence. So this plan in general, as I said, would shift really that paradigm of focus to goals that we can then be accountable for and try to achieve by 2030. And they include better health and well-being, reduced inequalities, building innovation and infrastructure. So what do we mean by each of those? In terms of better health and well-being, and in terms specifically for rare diseases, we know that the first stage in getting treatment and then improving health and well-being is in getting a timely diagnosis. So we propose as a sub-target in this goal, for example, that the reduction of diagnostic delays for 90% of people living with rare diseases goes from the current average down to 6 months. We also propose that we can consider, and certainly probably by groupings of rare diseases, that the life expectancy of certain people living with certain disorders could ideally be extended and realistically be extended, and we can consider how to measure those. In terms of inequalities, we know that a large proportion of people living with rare diseases not only are burdened with the clinical sort of features of their disease, but all of the surrounding vulnerabilities that they face as a result, which are both social, economic, and psychological. And we know from our own surveys at EURORDIS, from hearing from all of you, certainly from reading the literature, we kind of have a baseline of what some of those vulnerabilities represent. And so we propose that we would reduce those by 1/3. And finally, in order to make all of these clinical and more holistic progress in terms of the health and the well-being of all of us, we need to have an ecosystem that allows that to happen. We need to have an ecosystem where people have incentives to invest either in research or in drug development and to maintain interest in this field. And so we, in general, strive to build innovation and infrastructure, and more specifically give some sub-targets about how that could happen, either quite concretely with this target that you'll recognize, which is 1,000 innovative therapies by 2030, as well as a number of others. So that's a bit of detail about the goals. And again, just to reiterate, they weren't pulled out of thin air. It was really the result and the merging of two efforts. One, this multi-year reflection with experts in Rare 2030 and the existing framework of the SDGs, which our colleagues at the Commission have somehow already committed to achieving. And so this action plan is really an effort to, of course, address our unmet needs as a community, but also doing it in a way that's the most achievable, attractive for policymakers to recognize that we're actually contributing to these larger, even larger goals. So a bit more detail about what we can imagine that this action plan would look like. Of course, any proposals that we give in this time, and I'm going to go into the timelines in a few slides, we're talking over the next 3 years. So of course, a lot of this will change. But what we envisage, having analyzed other action plans and having analyzed how this would, again, be most beneficial to the policymakers and all of us who would then need to implement these plans, is that we would go across these 3 goals that I just described, and that under each one of those, that under all 3 of those goals, there's a series of areas of action. And not surprising, you'll see some of the same themes there, of course, that we have in Rare 2030 and that many of us work across every day. So this is just to get you a bit more familiar with the vocabulary that's used in these action plans. So areas of action are then divided amongst supporting actions. And quite often within those supporting actions, there might be one that's considered a flagship, an action that is very much key to gaining the success of reaching the goals, and without which those goals probably can't be reached. So a kind of putting certain actions on a pedestal, showing their really key importance. And then finally, you'll notice on the bottom of the slide that we imagine that there'll probably be some cross-cutting areas of action, of course, all of those concerning data and anything digital, because that's relevant for any one of these sectors, if you will, and the partnerships needed for that to happen, whether it's private, public, or private and public. And very finally, but not the least, of course, is a recognition that all rare diseases are actually not equal. And although we really maintain the imperative focus that we stay together as a community because we have all of these common obstacles, it's becoming clear that there's certain approaches that might be more appropriate for the diseases in which there's really an extremely few number of people affected. So we imagine that there might be some dedicated efforts to that. So that's, a lot of information for those who are hearing it for the first time, and maybe new information for those who haven't, or who have, sorry. I think we're going to open it to questions. I don't see any in the chat. Other than, can we share the slides, which of course we will gladly do.
No questions. Any parts of the plan that interest people, write it in the chat. We're happy to come back to them. Okay, should we carry on then, Anna?
Absolutely.
And if anything comes to you, just keep, you know,
it would be, it would be nice to hear if, just in general, if this is completely new to any of you, even for us to be able to come back to you maybe more individually if you need more information, if there are parts of it that are unclear, please don't be shy and put any questions, small or big, in the chat. So all of that I described was, I think we have a hand raised. I'm very excited to hear from you. Can't tell who it is though. Dorica.
Hello.
Hi,
Hi,
Dorica.
Dorica.
Yes, can you hear me?
Yes.
Yeah, thank you very much for sharing this with us. I think it's very interesting, and it's very important to concentrate on a few goals which are measurable and achievable. And hopefully we will have a new policy at European level soon. What I would like also to sustain is to correlate this with the national plans for rare disease, because most of the national plan have to be updated at national level, and I think the national alliances should be aware, and it would be very good to exist a continuity of action and to introduce these priorities at national level too. That's my view. But I think it's very concrete and very good. The presentation is very good, and yes, I would like to receive it if possible. Thank you.
Absolutely. Thank you, Dorica. And I think you bring up a good point, which I can add on, which is, yes, as we speak, we're all still living with rare diseases or caring for people with rare diseases and advocating for rare diseases, and probably helping in some places draft national plans or other policies on rare diseases. So you bring up the good point, which is these recommendations are already out and published and available, and hopefully a useful resource to become familiar with, because a lot of the suggestions about how this can best happen between now and 2030 is already described there. So for any of you who are just diving into certain areas of data or real world evidence, or maybe those of you who are really active in drafting plans, they can be a helpful resource. So yes, I think we can go on to what's new, maybe in terms of the campaign. So that was all of the background work that was done in putting forward this proposal. Now, what have we achieved basically since we launched the proposal, and what's coming next? So, as with any good advocacy organization, we have a clear strategy and a multi-layered one, because of course it's not one actor who can make this happen. So many of you might be familiar with this slide, but of course the European Commission is our closest friend in terms of trying to work on an opportunity to make this happen. And we know that the European Parliament and of course the Council are equally key institutions in making those decisions. And so those are the institutional bodies that we're working with to try to propose something that's realistic and reasonable, all while reflecting our needs. But we're also working on what we're calling the grass tops and the grassroots level. So the grass tops will include many stakeholders that are probably with us here today, who are key influencers or individuals that also have often direct impact on how these policies can be shaped. And in terms of grassroots, of course, really being the key piece of any campaign, making sure that the community at large who's benefiting from these policies is on board with everything that we're proposing. And then finally, on the bottom, this business as usual, that's what I was referring to, and thanks, following to Dorica's comment, which is that life is happening. And so a lot of these recommendations already need to be taken on board before we might actually get an action plan. So in terms of timing, we were supported by the Commission and the Parliament to start this reflection in Rare 2030, following or kind of at the same time as the publication of a European Court of Auditors report that was looking specifically at cross-border healthcare and the directive that guides that. And not only did the report find both positive and negative aspects of that directive, recognizing that there's still much work to be done in terms of the needs of people living with rare diseases, but actually there was a very important reflection on the fact that this directive does not work in a bubble, and that it probably merits reflecting on the full policy framework, all of the policies that concern rare diseases. And so there was a suggestion that this should happen by 2023, because of course, these goals that everyone is working towards in 2030 don't happen overnight. And so there's a recognition of the fact that in order for them to be implemented and for the fruits of those policies to be actually born, we need to really start much earlier. And so this timeline and the sort of deadline, if you will, of putting this action plan into place before 2023 was proposed. So now, knowing that, we know that there are a number of member states who will have a privileged position at that moment in time to be bringing rare diseases or this action plan to their agendas during their EU presidencies. And so we not only we have identified, but they've identified themselves as being in a place to do that. And so what we see is that all of these activities are happening across these 6 key presidencies. So to work through the whole timeline of the campaign, which starts with the publication of Rare 2030 recommendations in the beginning of 2021, we then begin proposals and kind of informal discussions and the launching of this grassroots campaign, ultimately to be able to have a series of political actions during these 3 presidencies that will ultimately lead to the adoption, fingers crossed, of an action plan by December of 2023. So that's an overview of the timeline, and I'll go back to it again at the end of my presentation. So keeping that in mind, and as you saw, the 3 key member states, France, Czech Republic, and Sweden, and then following Spain also has a key role. I wanted to give you a bit of an update about the feedback and support that we've garnered. So feedback in terms of the Commission, what we can understandably recognize and hear is that nobody disagrees with this plan. And nobody disagrees that we have unmet needs, that the policies need to be updated, and that ideally they would be housed under one umbrella. The question is when. Clearly, COVID has turned priorities kind of upside down. And so what's key to understand that it's a matter of timing. Ideally, we would have hoped that the proposal of such an action plan would have come just after the reflection and the recommendations, but more likely we consider that if it can happen, it would happen in 2023, just to refer to that timeline. In terms of the presidencies, we've managed to garner the support from this trio, starting with what we believe to be, although this isn't officially, I think, published, a clear support on the trio agenda. So not only does each country have their agenda of what they'll be addressing during their 6-month presidencies, but the overall agenda for those 3 countries together. And what we have reason to believe is that this trio will not only encourage further measures for tackling antibiotic resistance, but also rare diseases at the European and worldwide levels. What we are also very excited to report is that the French have also very officially committed to putting rare diseases on the agenda across all of the relevant cabinets, including the Ministry of Health, Research, European Affairs, the National Parliament, and the cabinets of the President and Prime Minister. And all of that support will culminate in what is called a high-level conference on Rare Disease Day of 2022 in which this official support will be communicated. And then what we are also very encouraged to see is that momentum will not stop with the French, and will naturally then be passed on to our colleagues in the Czech Republic, who have also committed to rare diseases on their agenda. And in terms of just a bit of context, for those of you who are following the debate on the orphan drug and pediatric regulations, that's the same time frame that those regulations will be out. So if we move on to Parliament, I'm going to pass it on to Jenny, who's going to tell you a bit more about those, and then the ways that you can get involved, not only with parliamentary members, but your stakeholders in your organizations.
Kostas, do you want to take this? Or should I do? Okay. Perfect. Okay, so the European Parliament, as Anna said before, there's 3 layers kind of in the 3 European institutions are key to getting Europe's action plan on rare diseases. And the European Parliament have a really strong role in applying pressure to the European Commission upon the European Commission. So we have been working with them, I think, during the EURORDIS membership meeting, and otherwise you might be aware of the parliamentary network of rare disease advocates. So we have kind of revived that group and mobilized that group so that they can focus on the action plan in the coming year. We're also beginning to prepare an oral question for resolution, which I'll come back to in a second, what that is and what that means. But also we're hoping we'll have some kind of event with members of the European Parliament present in the lead up to the French presidency, or at the beginning of 2022. So as a reminder, there is a template letter that we wrote and shared with you at the EMM, at the EURORDIS membership meeting, which invites that you can use to invite your MEPs to join the network of parliamentary advocates. As always, the more support, the better, and that will be fantastic moving forward. So I said the oral question, so this is what we are beginning to prepare. So an oral question for debate is a really strong instrument to put pressure on the European Commission for an action plan. So this goes through a couple of steps. So ENVI, which is the Committee on Public Health and Environment, would submit the question, which we would support their drafting of. So we would have some background on why we need Europe's action plan for rare diseases. And then a couple of questions directly to the Commissioner about what they will do about it. It has to be approved by the Conference of Presidents. So they will decide whether to table it and when they will table it. And then if it is accepted, it will be included in a plenary session debate, which most likely would be probably at this rate on the week commencing the 14th of February, which would be fantastic ahead of the high-level conference of the French presidency. So we are still working on the timelines of this and when this will be, but there will definitely be a role for EURORDIS members and the Council of National Alliances to maximise member of European Parliament engagement during this process. So in briefing MEPs from your country, which we will support, and in getting them to get involved in the debate. So the other thing that we are doing, so I'll move on to grassroots now, which I'm sure you all know about, but we are also calling upon the European institutions to take action by collecting your reasons, the reasons from across the whole rare disease community for action on rare diseases. So far, I think as of before this meeting, we had 1,439 reasons, and they are from across the whole of Europe and beyond. They are incredible. We've been working on going through them, making sure that we know kind of what they're saying, how we can use them thematically by country. They're really extremely powerful. And the idea of this is that we can take these reasons directly from people living with rare diseases, people caring for somebody with a rare disease, from healthcare professionals working in rare diseases, from researchers, from industry, and present them to the European institutions to show, alongside the policy, the real world reasons why we need this, the kind of the evidence from people's mouths. So far, as I said, we have 1,439 reasons. We're hoping to get 2,000 by the end of September, and hopefully 3,000 by the end of November. So we need your help in doing this. As I said, they're incredibly powerful, and I'll share some in the following slides. Here is a kind of, as of, this is the number of reasons per country. So that's just the top 15 or so. But as I said, they're from across different countries. And if you see your country there and it's doing well, then fantastic. If you don't see it there, then please do share and encourage your networks to include those reasons. They will be presented directly, so every reason will be included in some way or another to the institutions. So every reason does count. So the idea that we had is to hand in these reasons in as a book to the European institutions. So we are beginning to prepare this book, think about what this would look like, how we can best present these fantastic over 1,000 reasons to them, so that they can see all of the different, the variety of challenges, of hope, of reasons that people have put forward. We also will be using the idea in the 30 million reasons, so representing the 30 million people living with a rare disease in Europe, to prepare a video if we have an event, as I said, in the lead up to the French presidency. If anybody knows of any case studies or would like to be involved in either of those with more of a focus on your story or someone from your organization's story, then please do get in touch with us, because we're beginning to prepare those case studies, which will give a bit more detail. So this is the kind of the example of how we'll use the book. So we'll have a page per country. We'll have hopefully a bit more of a focus, and then we'll share lots of the reasons. This is very much a mock-up. We're thinking at the moment with graphic designers how we can present it best. We may also reach out and try and have some political support or high-profile support from people within ERNs in your country, ERN coordinators, or people from industry, or people who might add some more weight behind that, to show that this is really a call from across the community. Here I've pulled out a couple of reasons that I think struck me, and were quite a variety of different angles. So, and from different countries. So Boris from France saying, we need Europe's action plan for rare diseases because the EU has the science, the healthcare and the industry to help patients living with rare diseases. Political will and incentives can turn science into treatments. Satu from Finland said, we need Europe's action plan for rare diseases because why do I have to visit many different doctors to get treatment? I would like to receive holistic treatment from one place. And a slightly longer one from the perspective of a doctor, from Victor from Czech Republic, saying we need Europe's action plan for rare diseases because as a physician working in the field of inherited metabolic disorders, I fully support EU-wide initiatives on rare diseases. We need to exchange expertise and study pan-European cohorts of patients with individual rare disorders to improve access to timely diagnosis and effective treatments, and to ultimately ensure better quality of life for patients we are serving. I hope that gives a bit of a flavour of what people have said, and I cannot ask enough that please share those reasons, share your own reason if you haven't already. Please encourage your networks to do it. it's a great opportunity. As I said, every single one of these will be presented to the European Commission. So if there is a focus you want to put on it from inherited metabolic disorders, your organization's work, and we of course welcome reasons from wherever you are. Anna, do you want to come back on the timeline at all?
Yeah, I was also going to maybe answer a few of the questions in the chat, some great comments coming in. So I see from Turkey and Portugal that these recommendations are already useful in your work. So that's very encouraging to know. Thank you for sharing that. And particularly for Turkey, I thought it was a good opportunity to just mention, of course, this isn't a campaign to push for a European policy framework, but as Turkey or many other countries across the world really recognize, these efforts need to be, our efforts need to be headed in the same direction. And so that Europe's plan for rare diseases will hopefully be compatible with North America's, Asia Pacific's, and that will be working towards the same goals. So I know for candidate countries in the EU, of course, this is something that they keep a close eye on, but it really could be the same case for anyone. Then I see a question from Julie Bertorelli. Hi, Julie. Is faster rare disease drug approval a part of this plan at all? Yes, both very directly and indirectly. So you saw that the plan spans from research to development to access, and even earlier on collecting data and understanding the diseases. So there are really a number of chapters in what we hope would be an ideal plan that would address faster approval. That can be from making sure that we have the threshold of data on certain diseases so that researchers are actually able to start some of the basic and clinical science. It's ensuring that we have better networks, clinical networks across Europe. So again, all of this progress is shared. It's supporting and advertising guides that have been written by sort of learned societies, specifically the EURORDIS, the International Rare Disease Research Consortium, which has come out with a Galaxy guide just for that, how to improve the success of approval, and all sorts of other kind of innovative, if you will, or alternative streams of efforts that can all lead to faster approval, repurposing. Yeah, there's a number of them in there. And then finally, some recommendations around access, because that's the whole point, of course, is this is one continual life cycle. And if we don't have any information about how these drugs are actually working, if they're not accessible in the very for the very people that we're developing them for, well, then there'll be less incentives and investments in any of this work at all. So great questions there. I think that's it. Social cards, yes, we have those. So we'll be happy to share them with you and with everyone else.
Okay, super.
So yeah, the timeline, we just wanted to go back and show kind of some of the pivotal steps in this campaign, just for you to keep in mind. Of course, I know in your busy lives, schedules, your own advocacy strategies. But yes, to understand that the ultimate goal would be for this to be adopted in 2023, but that there are a number of actions that need to happen in order for that to be the case. Not the least of which is we need the Commission's support to start doing this, and we know that that will begin to happen during the French presidency in 2022 when they start drafting their EU for Health work plan. So what I wanted to also draw your attention to were these key outward-facing events. The high-level conference from the French, which is being drafted in terms of the detailed agenda, I think, as we speak. but I know will be streamed for a number of viewers and even translated into several languages, including English. So I just wanted to make sure you mark your calendars for that. And then I think, Jenny, you had a slide on the next big event that will be also happening in 2022. And that's the ECRD. So most of you should be familiar with this conference, which is always a point for all of us to check in every 2 years and really try to leave the conference with a clear vision about what we need to do in order to achieve some of our goals. So what better platform than to discuss this action plan and to make sure everybody leaves knowing who does what and by when. So please mark your calendars for the ECRD. Unfortunately, or fortunately, it's going to be online. So we hope to include maybe even more of you with us than usual.
Super. Okay, so I'm sure the question on everybody's lips is, what can you do right now to join us in this campaign? So as I've just shared the link, please do share your own personal reason. I'm sure everybody on this call already has, but if you haven't, then no time like the present. It would also be fantastic if you can encourage your networks to do the same. As I said, this can be a way for you to put the emphasis on issues in your disease area or country. We will be collecting them. So this is the focus for us now, and where you can help the most. Until November or the end of November, we'll be keeping you updated in the EURORDIS member news and on social media about when this will be open till, but it is not a rolling thing. There will be an end date so that we can prepare the book and get organized to directly hand this in to the European institutions in February. So at the moment, that is our biggest ask for you. As I said, once we have a few more details about the oral question with debate in the European Parliament, we will be looking to our members and the whole community to engage as many MEPs as possible on this, so that we make sure that we have the support we need in the European Parliament to raise this question. So that will be probably our next ask, so keep an eye out for that, but I'm sure we'll share more information soon. And then, as Anna said, save the dates. There's the high-level conference on Rare Disease Day, the 28th of February 2022. I'm sure you have a lot of your own events on that day, so if you do, I'm sure the link will be available afterwards to catch up. But if you're able to join, it will definitely be a pivotal moment of this campaign. And then ECRD 2022, as Anna said, that will be a great opportunity for us all to come together across the rare disease community to discuss this in more detail. So I've got even more things here in case you have a bit more time and a bit more willingness. So sharing the reason, as I said, is the main one, encouraging your friends, your family, your colleagues to do so. But also bearing in mind, if you're in any meetings with policymakers or with influential people in your country who might be able to support this, please start talking about the action plan. We'll share these slides with you, and there's loads of tools already out there that hopefully can help prepare you. So, as we said, it's going to be a long process, but when the consultations and when it all comes around, we need as much support as possible. You can write to your MEP to ask them to join the parliamentary network for rare disease advocates, and you can talk about it on social media, which segues nicely onto what we have available for you to do these things. So on our website, EURORDIS.org/30millionreasons, you can access all of this. So we have a platform in 23 languages where you can share your reason directly. There's also a fact sheet in 23 languages, which sets out why we need this plan, why we need a European framework for rare diseases. Hopefully in quite a convincing manner in 23 languages that you can use, you can leave with policymakers, you can share bits of, that's there for you to use. Of course, the Rare 2030 recommendations are the backbone of everything we are doing with this campaign. So please use them. There is so much information that is really valuable there and can go into more details in particular on particular issues. There's also a social media Trello board that I know Julie just asked about. So on this board, there are ready-made gifts, such as the one on this slide, as well as some media, some other photographs, some visuals, and some suggested messages. There's a campaign press release plus some articles that have come out about the campaign that might help put it in context. So they are all available on this website, and the letter to MEP template. So if you're inspired to do something now, that could be a good way to end the day. I'll just ask if there's any more questions at this point or anything else in the chat. Just Anna sharing the different boards. Super. Are there any other questions from anybody who is attending? Anyone raise their hand or write in the chat? I hope it's been interesting. I hope you've got some new information and you are still enthused to join us on this campaign. We need as many people as possible. Any final words, Anna? Because otherwise I'll share the Rare Barometer slide. Anything else?
No, thank you all for being here. And yes, we have one more potential point of interest. Yeah.
So the Rare Barometer Voices survey platform, which I'm sure you're all part of and aware of, it has just launched a new platform for their survey on diagnosis. So it's one survey with 2 phases. This is a bit of a segue, but just to let you know that this is happening. We know there's so much information that comes from us, but this is a really interesting one and has been identified as a survey need for a long time. So we will now be doing this, and there is going to be a week-long online discussion panel. Don't be daunted by that. It's only around 15 minutes a day, so there'll be certain questions every day and an opportunity to share testimonies, videos, images, and ask questions that are selected by the moderator. We can share that link in the chat as well. It will be in mid-November to the end of December, but obviously we want as many people as possible to join this, and then we will be able to have as rich a discussion as possible around diagnosis of rare diseases.
I can just quickly add, Jenny, for this survey platform, which we didn't explicitly mention today, but many of the recommendations coming, or most of the recommendations coming out of Rare 2030 were a result of this, your feedback through this channel of data collection and opinion collection. So please don't underestimate the value that it has for all of us at EURORDIS and everyone working in the field to really make sure that the position papers and policy proposals that we come up with reflect all of our needs. So this is one survey on diagnosis, but there'll be a number that are feeding into this action plan and other advocacy efforts.
Excellent. Yeah, so we'll share that that link, and I hope you've already signed up, or if not, we'll share it with your networks as well. So I think then that's just left to say is thank you for joining us today. I've added one more reason, which I think is quite a nice one to explain why we are here and why we're doing this. So Maria from Spain said her reason for European action is, may a day come when we do not have to have reasons for everyone to have the right to a rapid diagnosis, access to treatment, and the best possible care. Health is not a reason, it is a right. So the goal that we are always working towards. Thank you for joining us. If you have any other questions, you can email us. and or contact us, and all the information should be on the website. Thank you, everybody.
Bye-bye. Have a good day.